Thank you so much for having me today in this, I think, wonderful forums. We actually dreamed to have a regional forum on Chemsex for a long time, and thank you so much, Taiwan, for leading this. I worked with you in the last year symposiums and deliver the presentation virtually, and today I'm so happy to be here in person and see a lot of familiar faces. And I'm super delighted to represent Lighthouse Social Enterprise and community-based organization in Vietnam to um, humbly share with you about one of our peer-led interventions in integrated HIV and chemsex services for community in Vietnam. I would like to acknowledge VIP Healthcare positive actions and also UNODC for your generous support for Lighthouse work on chemsex and also Vietnam Administration of HIV and AIDS Control for technical assistance. I consider that chemsex is really massive and diverse field, and our understanding regarding this community are still very limited. So most of our intervention is really based on our 2019 survey on chemsex community in Vietnam. So this is some common substance or stimulants drugs used in high fun, or in Vietnam we not call chemsex, but we call high fun. It's more like local languages. So people are easily to say, do you high fun, or they easily to go to the gay dating app to find some like partners by like some very specialized science and languages in there. So methamphetamines or crystal meth is still a most common substance among the high fun community. And you also can see other names of drugs like ecstasy, methadone, ketamine, GHB, GBLs, and also other substance like Viagra or popper is really common and very familiar among the community. We also trying to find out what is the reason for engaging chemsex. So most of people trying to use drugs or engage in chemsex to increase the pleasure when having sex, and also trying to performing the new sex behavior that they are not confident to practice while they not have the drug use. And also some of people, they said that the first time when they were exposed to chemsex community, because they face with some like mental health issues or face with some trust, also introduced by their friend, because it's really familiar, and a lot of people, they're saying a really good thing about the chemsex. And also, we also very interested to see among the male sex worker community, and a lot of them using drug because they get higher amounts of payment from their clients when they having sex. Where they look for partners. So most of them finding partner from the dating apps like Grindr, Jack D, and Blue. I think is also very familiar with most of you here. Also in the social network, there are some private groups for the chemsex community, in particular in Facebook or Twitter, or now it's called X, and some of the local dating apps. And they also find some partners from saunas and forums and entertainment venues like bar and clubs. And this is a health service experience. As you can see, most of them are not really experienced with some like very extensive health services like HIV test, PrEP, or STI, or hepatitis services. So this is definitely a big gaps that we need to really address in our intervention. And this slide is really, I'm not going into details in the different layer of barriers faced by the community, but as you can see, they're not only facing like some personal barriers, but also the other like services barriers and also structural barriers as well, especially in Vietnam context where drug use is still criminalized. So they face with a lot of like, the risk with police and also any like personal securities issues. This is a chemsex user support needs. So we trying to divide them to different kind of like aspect. But when we go into details of the intervention, you could see like we were trying to use the intersectional lens to make sure that we can meet the diverse needs of the community in terms of the physical health, not only HIV and STI, but a lot of people also interested in like dental issues or like like the other health issues rather than just HIV and STI. In terms of mental health, there are also a lot of issues that people are facing and trying to finding helps. Also with the social support and cut down and stop using drugs. So based on those kind of foundation of understanding from the community, from our survey and also our daily practical activity, we trying to design like some primary intervention for the chemsex community in Vietnam. One of our key focus, I think, awareness raising and demand generation is still a really big gaps among the community. Not only because of the law and policy, but also the restriction on some social media platform where we are not allowed to promote for the drugs and the other practice of drugs. So we have the specialized communication channel. We have the fan page. It's called High Fun, where we can deliver a wide range of knowledge and information to the chemsex community. We also have one dedicated website for our own clinic to provide the friendly and quality services to the community. We also host a number of peer-to-peer meetings to really share among the community, to connect the community together, and then they can support each other. We also design dedicated materials on High Fun, on chemsex to deliver and distribute among the community. In terms of the personal support, on-demand comprehensive health services. So we have the dedicated peer groups who provide the outreach and also personal support to the community via like in some hotspot and also in some social media platform. But we also have the Lighthouse Clinic as one of the one-stop shop clinic to offer a comprehensive health package to the community. And lastly, our third, I think also very important prong of our intervention, that is chem care and social support. So we gather the chemsex support groups so they can support each other. They also can learn from experience from each other. And we also generate the family support for the chemsex community. That is really interesting that among our clients, it's not only the chemsex user, but a lot of the family member who also reach out to our team to ask for support, and they're willing to support their friends or family members. This is the first strategy, is optimizing online outreach. You may are very familiar with those kind of the logos. So a lot of our chemsex users, they use this kind of guiding app to find partners and to introduce about the chemsex groups. So we're trying to spend our peer outreach worker to this kind of the online platform, and then they can easily to reach the chemsex community and provide the information and support to them. We also do a lot of other outreach and commodity distribution. We redesigned the condom package. It's actually distributed by Global Fund, but it's look a little bit, I can say like very boring for the community. So we're trying to redesign it, play safe with the brand name. So make sure that people feel like safe and comfortable when they use the condom and lubricant. We also have a lot of outreach from online and offline activity as well. This is the chem care boxes. We also distribute and chem care boxes to the community. Even that you can see the long list here, but and this long list is collected from the community consultation. But we are not able to provide all of them. But I'm trying to put the list here for you, and it depends on your resources, so you can consider to provide those kind of this commodity to the community. HIV self-test kit, of course, both orals and also finger tests. STI self-test kits if it's available in your countries. Condom and lubricant, dry paper and wet wipe, drinking straw or smoking pipe. Also rehydrate, we call that Orazole, lip balm and chewing gum and the others. This is the education and communication. Unfortunately, in Vietnam, we are not able to like provide the real people image in our social media, especially related to the drugs content. So we're trying to convert it to some animations, photos, and as you can see in here. So we're trying to diversify the content for the community, not just only focus on harm or like some effects of the drug use on their bodies, but also trying to explore the new content that is more appropriate to the community. For example, like sex with chem, more focused on pleasure, information about drug recovery after chem sex section, also addressing common issues like meth mouth, sleep disorders or headaches or the other issues that they are facing. Also talk a little bit about the strategy to cut down or stop using drugs for those who are interested in this area. So one of our lesson learned is the content development and support service should be tailored to the community need and habits. So we have the community, Chemsex community advisory groups who help us to determine what kind of the content for the community. This is another photos from our fan page. It's called Chemsex. So we deliver a number of content, not only posts, but also like in some live streams and also like some video clips to share with the community. This is our peer-led service delivery component at Lighthouse Community Clinic. As you can see here, some handsome health providers to like attract the Chemsex community and using it for promotion of our services. This is the overall of our services delivered to community. We not directly deliver all of them, but we're trying to put them in the list. And when community they're looking for any specific services here, so we can easily to refer them to the friendly services around the area. So we have the Chemsex and ATSU screening and counseling services, HIV and AIDS, of course, and STI screening and checkup, as well as with the mental health screening and support as well, and also PrEP and PEP services. So we using the person-centered care approach from the community to community. So it's basically that we train a number of the Chemsex users to deliver services to the communities themselves. This is the customer's journey maps. So in each touch point, we're trying to imagine like how, what is the expectation of the community and trying to make sure that they can receive the most quality and friendly services as possible. So from when they reach the information online and they start interested in our services, in our support, and when they go directly to our clinic, and when after the services, and we trying to remain the relationship and connection with our clients. This is the procedure. I'm so sorry because it's in Vietnamese. So we start by the outreach programs, and we have some tool for our peer educator to screen. So we use ACEs to screen about the drug addictions and also like some experience with drug use of our clients. And for the mental health, we use PHQ-4 for the beginnings, and then afterwards, if they have any symptom of the mental health illness, we will screen them with another in-depth screening tool like PHQ-9 and GAT7. And afterward, based on the result, we will refer them to a specialized package and make sure that they can reach to the psychologist if they have any mental health issues, and also to our Chemsex counselor for some like harm reduction services. And we also refer them to the Chemsex support groups if they are interested for the cut down and stop using drugs. Also with a motivational counseling specific for people who face with some issue with the drugs and harms. Yeah, and afterward, we're also trying to maintain the relationship with our clients and empower them to refer another Chemsex user to our services. This is our, like one of our criteria, trying to provide the friendly and safe environment for our community. So we not only provide the services at Lighthouse Clinic, but also working with other health providers to sensitize them and make sure that they understand about the needs of community and they can deliver the friendly services when we refer someone to their clinic. This is another activity that we're trying to build capacity for the peers and for healthcare providers in some different way. This is the last slide, and this is the next steps and also lesson learned from our models. I think sustain the demand generation activities across various platforms to enhance the effectiveness of the outreach and service delivery is really important, and we still focus on it. Collect empirical and continuous data. Like I think Adam also emphasized that we like a lot of data, and especially for some intervention measures. So I think this is really important for the next year Chemsex Symposium. We hope to hear more from like some trial, also some community lead data as well. We also pilot the family empowerment approach, like I said. It's really important to involve the family in the intervention and harm reduction services. Also, we found that there are a very high rates of self-stigmatization among the Chemsex community, and we definitely need to have some other intervention and approach for the self-stigmatization field. We also trying to pilot some teleservice delivery option through the digital solution for the community, as many of them trying to avoid going directly to the clinic or services because of stigma and discrimination and also criminalization risk as well. Advance the Chemsex support groups and carefully monitor its effectiveness and promote for the service currently limited, such as like hepatitis and also nutrition support. Also with the Mpox, now in Vietnam we see the increased cases of Mpox, and I think it's mostly among the people in the HIV community. So I think it's really important to integrate the Mpox prevention in the harm reduction package. And lastly, continue to work closely with the government to strengthen the healthcare system, sensitize the healthcare providers, and make sure that the national guidelines reflect the effective measures of the harm reduction package for the community. Thank you very much for your listening. That is the last slide.